Peace and assalamu alaikum everyone. It's Mom Sahana at that end. Sorry life. So I wanted to do sort of a PSA sort of a thing. So I somebody tried to sort of come for me on Instagram because there was a like little video someone put on Instagram. It's a black woman in nursing home. I don't know what her position is, if she's an aide or a nurse or whatever. But so she put a video on there of this older resident, this white man, and he was, just counting her like extensions. She had these extensions in, and he's counting them. He's like 17. He gets excited or whatever. Not really excited, but he's having a good time interacting with her. So people are all in the thread like, oh my god, this is the cutest thing ever, and all this kind of stuff. All the cutesy, like, ooh, old person, cool, And but I said lightheartedly, but nonetheless, I said something like, I work in nursing homes, and there's no way he would be playing in my hair, right? And I put like a laughing emoji or whatever, and kept going on about my business. And then actually it got some likes, whatever, which is not what I was going for. But I say that to say, because of what I'm going to say next. So one guy, he actually replied to my comment and said something like, I need to, he said something like, I need to devolve and show some empathy, or else I shouldn't be working in elder care at all. So I said to him, summarizing, I said to him pretty much, well, maybe you don't know like what it is working in nursing homes, but I do. And I know people are digging in their noses, they're like inside their brief scratching, sometimes far more often than you would think. They're like playing with their feces, they're like, it's food caked under their nails, all kinds of stuff. And I said, these are germs. People look at these elders like they're these cute little, oh, look, he's still living. You know what I mean? And not like, yo, there are very dirty, nasty habits that are going on in a nursing home. But I said that to him or whatever. I don't know if he responded. I really don't care. Oh, and I also said that people not worrying about cleanliness is exactly what is spreading this daggone COVID all over the place. I, I actually have a site open now. It's worldometers.info. And just because I wanted to make sure, like, if this was still accurate. But America is number one in the entire world with COVID deaths. America. Everybody talk about America, land of the free. It's like the richest country, it's the best country, and all this. It is the nastiest, dirtiest country, and the proof is in the numbers. You know who number two is? India. Okay, enough said. So what I just wanted to make this video to sort of make people aware, like, listen, not only is COVID spreading, but nursing homes are suffering. I said in a video the other day talking about this new nursing home I'm going to be working in. In a matter of 2.5 weeks, they have like 100 COVID positive cases. 2.5 weeks. 2.5. Did you hear me? 2.5 weeks equals 100 COVID cases. This one facility, and that's only the skilled unit. The cases over in the assisted living is also rising, but it's far lower, but nonetheless it's still rising. And last I heard, there were like, I think 14 deaths in 2 weeks. Okay. um Cleanliness is still not at the top of people's list. And even if there was no COVID, there are a hell of a lot of things that can pass along through touch. You feel me? Um, and again, nursing homes are disgusting. They just are. Hospitals too. Hospitals are disgusting. I saw a study I didn't see a study. I think it was when I was in nursing school. They were saying they posed the question to everyone. What do you think is the like filthiest thing that is in a hospital? And they were saying everything, like from the stethoscopes to the this to the that. It's the curtains. Yep, it's the curtains. And I'm telling you now, the curtains in a nursing home, honey, I have never, ever in like 10 years of working in nursing homes, I have never seen the curtains cleaned at no nursing home I've ever been in. But aside from that, we have the carpets down. Like, I've never seen a nursing home that didn't have carpets down. You know, carpets just in your house are disgusting. So we're talking about nursing homes where people are urinating on the floor, and these carpets have been down here for years. Even though they, try to do their steam cleaning and stuff. Come on, how much is it really sanitizing and disinfecting? People urinate on the floor, you know, in the resident rooms where there aren't normally any carpeting. They still don't clean it but so well. Seriously. And the age, you're not supposed to do this, but it's very, very common in nursing homes when the aides are changing. The residents, their briefs and stuff like that. They just take it, throw it on the floor until they can finish with the resident, and then they put everything in bags and stuff like that. All those things are on the floor. We have, forget COVID. I mean, we have E. coli all up in there. We have, what's the other? Yeah, we have E. coli. We have, again, urine and stuff on the floors, and whatever's going on with somebody's urine, all that stuff is going on the floors. You have, again, caked in food and feces and all kind of stuff under the people's nails. Listen, and it's not because nobody is doing their job. They get washed every day, of course. If you have any family members or have ever been in a nursing home or anything, there's so many people, they're only getting showered 1 to 2 times a week, depending. And they hair washed or whatever. And that's not even everybody. A lot of families don't want their relatives hair washed. They want them to just get it done at the salon, and that too is not very often. It was a pin, like every week, maybe 2 weeks, depending on how they want to spend their money. What else was I going to say? Yeah, so it's not that we're not doing our jobs, but as I've said before, and again in another video, nursing homes are a whole different animal from hospitals and places like that. Absolutely different. Where nurses will have up to 5 patients in a hospital, and that all depends on what the census is for that day. In nursing homes, we have like to a unit, depending on how your nursing home is set up, to a hall or to a unit, 30 residents, easy. So you're talking, the nurse has these 30 residents. Then staffing is always a problem at like every nursing home. So out of 30 people, if you're lucky, you'll have three CNAs. So they'll have like about, let's say 8 to 10, depending on what the census is. But normally they'll have 8 to 10, or sometimes more. That's if there's 3 aides. Normally you don't have 3 aides. You're super lucky if you have 2 aides. So you're talking about each of these aides have let's say 15, let's say 12 to 15, just being generous here, 12 to 15 residents to take care of. That means by like 7:30, you have to have 12 to 15 people up, washed, dressed, put in their wheelchairs, taken out to the eating area, or if they can't come out their room or don't want to come out their room, you have to worry about feeding them in there. So that means your time is even you have even less time, because you got to make sure everybody who can go out is out, so that you can get to the room to like feed these other people who have to be fed. Then, God forbid, if you have doctors, or well, not that early in the morning, but if you have therapists that are coming in, or listen, so it's not like folks can just run around cleaning everybody's nails all day long, or making sure they're not digging in their brief all day long, or you know what I'm saying? That's the reality of it. Now I know a lot of people probably listen like, my pop ain't like that. My pop was always a fly dresser. He was like this, and he was like that. Sorry to tell you, if he's in a nursing home, pop too. It's just a reality. It comes with the reality of nursing home facilities. There's nothing anybody can do really. I mean, unless they get more staff, which they are not gonna get more staff. Um, it's just how it is. It's just how it is. So yeah, it's like cute and all that sort of thing when you see the elders interacting with, the staff or people there. But it goes far deeper than that. That's like and I mean, I hug them and stuff like that. But these are I know who I'm dealing with, you know what I'm saying? Um, I'm not eating after any of them. Like they'll be like, "Here, you want some?" Of course, you're not gonna eat their stuff anyway. Some people do. They'll like take their candy and thing. But I've seen people like use resident brushes, and I'm just like, "Ew, why are you doing that?" I just think it's gross to use another person. I used to be in the cosmetology, so I just think it's gross when you use another person's hair stuff. Anyway, that's why in the salon world and hairdressing and everything, they have to cleanse those things because it's nasty. Somebody having their hair even. So we're talking about residents touching on the staff members too. Remember, all these residents that are dying in the nursing homes, they're not on the outside. They're not bringing it in there. The staff is bringing it in. So two, we also have to be mindful of what we are passing on to the residents. This is all about cleanliness, child. And wait, there was something else I was gonna say related to this. I don't know. My memory is bad, but yeah, I just wanted to put that out there that people, you know, um, just be mindful of things, mindful of cleanliness. People who work in the nursing homes, be mindful of what you may be passing on as well as what they may be passing on to you, because we this is like education 096 for us who went into the health arena. You know that we pass things from resident to resident, or in the hospitals patient to patient. That's why how many people they go in the hospital with one thing and then they get infected with something else, even if it's just a urinary tract infection. It's because we are passing things from person to person. We have to be mindful. We have to not only get caught up in the moment or our feelings and such. Oh, the other thing I was going to say pertaining to dirtiness and things, most of us are well aware. Like, we will not wear, I won't say most of us, but a whole lot of us who work in the nursing home sector. Like, we won't wear our shoes, our work shoes in the house. A lot of us, before we even fully come inside, like, say if we have like a front room or something like that, we'll have a hamper there to strip out of our clothes, put it in the hamper, because we don't want to track any of that stuff into our homes and possibly pass things on to our family. This is a real thing. It just is. I see people come and visit their relatives in the nursing homes with little ones, and they just let the children like play on the floor, and they're like rolling on the floor, and they're like on the beds, or they're like the relatives, they're going to use the toilets. You don't know what your relative, your resident, you don't know what they may have. because it's not like we can just like, oop, don't do that. He has a urinary infection, or don't do that. He has, whatever. Um, or what the roommate may have. You have to be mindful, man. It's Elders are wonderful. I love working in this field. I purposely chose geriatrics because I do have love for it. But within that love doesn't mean that you don't use common sense. You feel me? So anyway, that's that. I just wanted to put that out there to everyone. So when you go and visit, or if you work there, that you just don't get caught up in the coolness of being around, elders, cool old folks without thinking, and wash your hands. Wash your hands even after COVID. Wash your hands before you come up in there, or like when you come in, but absolutely when you leave, because again, there's germs everywhere, and everybody who is a professional isn't always that clean either. All right, peace.